genetic testing has created a buzz for those in the field of medicine and means better treatment for men dealing with prostate cancer.
This month, the American Urological Association took a new position on prostate cancer screenings. Now, the AUA wants men between 55 and 69 to be tested. Apparently, it is no longer recommended that screenings start as early as 40 or go on anywhere past 70. Now, here's why. Many of those screenings lead to what they now say are unnecessary biopsies and a lot of side effects. Focus at 4's Candace Sweat joins me right now. I know you've been looking at this, so yes. New rules there as sort of the guideline. Right. Also a new genetic test that can make things better.
That's right, Pam. You know, 40% of all prostate tumors grow so slowly that it's really best to take a watch and wait approach. Now, I spoke with Dr. George Adams at the Urology Centers for Alabama, and he says that this new genetic test really allows them from keeping patients from being overtreated.
It was a shock because there's nobody in my family that ever had any like this.
68-year-old Bobby Smitherman found out he had prostate cancer in November 2012. His biopsy showed a high volume of cancerous cells, and doctors decided radiation was the best option. He's optimistic about his future.
Yeah, me and my wife, as soon as we get through with this, we headed to the Gulf, and then we go into Pennsylvania.
Other prostate cancer patients have something to be optimistic about as well. A new test called Oncotype DX takes a closer look at the genes inside of a biopsy sample. Urologist George Adams says it's changing the way doctors approach treatment.
They will review that biopsy material and look at the genes involved that indicate how aggressive these cells are. And so this can help predict how aggressive your cancer is.
That means doctors can then decide how aggressive they should be in attacking the cancer. In the past, Adams said they only had the biopsy to rely on.
The more that are positive, the more the volume of tumor is there.
Doctors also rely on the Gleason score, which rates how fast the cancer cells are growing.
1 is the slowest growing cells, 10 is the fastest growing. So if you have an 8, 9, or 10, there's no doubt you need to do something.
Adams says the Oncotype DX test will be especially helpful with Gleason levels 5, 6, and 7, the obscure mid-range. Not only is the test being praised for accuracy, but it's saving patients from treatments that can be uncomfortable, expensive, and cause unwanted side effects like impotence.
If it's not very aggressive, the chances are you're not going to die from this cancer, so you can be more conservative. Right. And that way you can do what we call active surveillance. And the other word for this is watchful waiting.
Adams, who is a prostate cancer survivor himself, says advancements in medicine like this one are about giving patients power and peace of mind.
A lot of people are scared of surgery. They don't want to have an operation. And then radiation is very inconvenient, for some of them. And so if they have that option where the chances are I'm probably not going to die of this, they may choose, well, I want to do the active surveillance.
And so, Pam, Dr. Adams says that this test could also prevent patients from being undertreated. Like in his case, he had those mid-range Gleason levels, and it turns out that his cancer was actually more aggressive than they originally thought it was. So it could work the other way as well.
Gives that little bit more information.
Yes.
What if you're one of those individuals, though, who does have a very low, slow-growing cancer? You're not in the clear.
You're not. Dr. Adams says that he really encourages his patients to get biopsies every year, even if they are in that mid to low range. He says a lot of patients are like, well, do you mean that I have to get a biopsy for the rest of my life? Well, yeah, kinda. And in that case, they decide to go ahead and get that aggressive treatment because they don't want to deal with it. But again, it's about giving patients that power.
And just the options.
Yeah,
know all of your options. You've been talking to people online today.
Right. Speaking of options, we asked people, do you deal with prostate cancer? Do you know somebody? What are the treatments? Hannah says that she had cryotherapy for prostate cancer. It freezes the prostate tissue cancer cells, and then the cancer cells die, and she says that it's a minimally invasive procedure, so that's one thing. Melinda says father-in-law had it. The VA did surgery on him and no other action was done, but I'm sure he didn't have all the other medical issue that they would have done more had he not had a lot of other medical issues. Bobby says dad had radiation treatments, and that's one of the treatments that actually the patient that you saw in my story had. He was getting radiation treatments. And then Karen says that her husband had surgery last June and is now on top of that having radiation treatment. So you can see that people go through a lot to get through this.
And a lot of people don't like to talk about it.
Yeah.
But it is critically important that you do and that you have the test.
Exactly.
All right. Thank you so much.